This is the KHMH's COVID-19 isolation unit today. It's been 2 weeks since it saw its last COVID-19 death and 9 days since its last COVID-19 patient. And this morning, we headed to the National Referral Hospital to get its CEO's take on the successes that the hospital and the public at large are now able to celebrate.
It has been a long-awaited experience for us. But to look back, I can say that from the start of the year, we started with our numbers declining. We were at under 10 cases, and eventually it just continued to decline until we are without patients in our COVID isolation unit proper. The numbers countrywide clearly has gone down. The number of confirmed cases have been going down, a steady decrease in numbers. And of course, it has an impact on who ends up in the hospital. So, because who is admitted in our COVID isolation unit are usually cases that are confirmed and with moderate to severe symptoms of the COVID disease, no?
But while COVID numbers are down, that might only be temporary. And that's why the COVID ICU remains at the ready. And this afternoon, its unit manager told us about the constant preparations that have to be maintained if and when she and her team are called upon again.
When our last patient came out, we terminal the entire area. So we would terminal and wash the entire walls, wash all the equipment, the beds, they get a thorough wash everywhere. And that is done at least one time for the week, just to keep it clean and ready. Today we just did a terminal again, just in the event that we have a next patient that comes in, that we are fully ready. We notice that our machines, they're kept clean and covered down, and that's why you see them in the bags. So we're just ready and always prepared for any patient that comes through the door at any point in time.
And once we reach that normalcy, there are other demands that could take precedent over a unit on permanent standby.
So what happens to the COVID isolation unit now? We heard rumors last week that it was being downsized.
So there are no staff members in the unit because there are no patients to manage, but the unit is just there waiting. Clearly, we cannot dismantle the unit until the country has declared and the world has declared that we are COVID-free, right? So in the we still need to prepare for whatever change in terms of the incidences or new cases that may pop up. The unit is a separate unit from other units in the hospital, so it's not taking away from any of our other service area, right? Because it's separate, it's dedicated for those types of cases, COVID management. So it's not disruptive, it's there, and we have intentions to maintain that for the future use, no? Other public health emergencies, other public health events, you never know.
And hopefully, this unit will stand as a relic to one of the darker chapters in Belize's public health history. But it's also a beacon of hope and a testament to the blood, sweat, and tears of the many nurses and doctors who fought against death and disease and have triumphed, at least for now. Cherise Halsell, 7 News.